Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the lumbar spine. It is the double limb lowering test. This test was first described back in 1983 by physical therapists Florence, Kendall, and Elizabeth McCreary in their book, Muscles, Testing and Function. So we've probably all read that book at one point or another. So in that test, they were having somebody lower their legs from a certain position to test the strength in the abdominals. This test has been therefore utilized by other people to see if somebody is like having back pain due to like weakness in those ab muscles or an inability to like control their pelvis with those leg movements. To perform this test, you have the person lying on their back. You can either have them cross their arms over their chest or put them up over their head. Then what you're going to do, you have them bring their legs up. Now they can bend their knees as they bring their legs up. And then what you want to do to measure this, you can either use your hand up under their back. So you just place it under there and you feel their back once they get in that position. Or you can use a blood pressure cuff that you feel to 40 millimeters of mercury, and then, so you hold it to that to have that pressure in it. You have them extend the legs up, holding there, and then what they do is that they lower their legs down. And once you either see the pressure drop in the cuff or they lose that pressure into your hands, meaning their pelvis tilts forward, that is where you measure them here. So you take your goni here and you measure that angle. And how they score, now how well they do with that degree, is that they have a score here, and that is how you perform the test. So what about the research on it? Well, it's quite interesting. There is some about this test. There's one paper that found that it has very good intra-related reliability, actually excellent intra-related reliability. Another article found that there is some anterior pelvic movement in young healthy adults when they perform this test. So these people didn't have back pain, but they still had a little movement of their pelvis. There's another article that found that adolescents don't do as well on it compared to adults, and so they were looking again. Healthy individuals with no back pain, they said, they just don't perform on it quite as well as adults. And lastly, there was an article back in 1987 that said there was no correlation between the performance of this test and like pelvic position or lumbar lordosis. So there is no research out there that says that this is a test that could be utilized for predicting back pain or saying that someone does have back pain. However, if you start reading some articles that references, it will say that. They say, well, this could be a way to look for back pain that it could be coming from a core. So interesting that it's out there, but there's nothing that says like this is a test to actually say someone is having back pain. So anyway, let us know. What do you think of this test? Have you ever utilized it? Do you remember it from PT school or something like that? So anyway, let us know down in the comments below. And like always, take care of yourself. Take care of your patients. We'll see you next time.